And here we go. Welcome everybody to The Big Idea. I'm Dr. Jeffrey Hanna. Today we are talking about gaze stability. What we're referring to is your ability to hold your eyes looking one way or another without getting blurry vision. We're going to talk a little bit about what some of the factors that can actually cause that, but also some stuff that I've started to see very, very recently in my own practice when we're taking care of a person's neck. Now, this is born from just some research that I've been doing recently, looking at a well-documented phenomenon that various chiropractic neurologists, vestibular physical therapists have been looking at for a really, really long time. But I am fascinated by this stuff because even after just sort of dipping my toe in the water a little bit for a couple of months, I'm seeing that this is making some really, really big positive changes in people. So I wanted to share a little bit about the stuff that I'm, again, only just personally learning about, but also what some of the neurology is and what some of the practical take-home exercises are that you can be working on if you are noticing that you have dizziness, you're having blurry eyes, that's most affected when you are in an area where there's a lot of stimulation, or if you are looking in very certain directions. Let's jump into it. First up, I think this is becoming one of my new favorite pictures here. This is what's known as the medial longitudinal fasciculus. It is a big mouthful for the conduits in the brainstem that are responsible for coordinating signals between your eyes, between your inner ear organ, so the vestibular apparatus, and then also the nerve receptors in the upper part of your neck. Point being is that you need coordinated signals from all three of these major inputs. Otherwise, you will start to have a breakdown and a failure. Very commonly, if a person has an inner ear issue, the brain is going to compensate by allowing or causing the eyes to start to work harder, or it's going to cause the neck muscles to start to tighten in order to compensate just as well. Now, it can also be that a neck issue is going to throw off and cause adaptation in the balance center, and then that's going to show up in the eyes. Point being is that if your eyes are being used to compensate for some type of inner ear or a neck issue, they eventually are going to fatigue a little bit more. And therefore, by testing eye function, you can see, whoa, do I start to feel a little bit lightheaded or a little bit dizzy for nothing else other than holding your eyes, looking off to one side or another. And there are two things that I don't have on this particular little chart, but they're illustrated here in the yellow and then the pink star. So firstly, yellow star. This is a little something known as the nucleus or interstitial nucleus of Cajal. This little guy is responsible for being able to hold gaze stability looking up or down. Interestingly, it's also located right next to a few other very important structures in the brain. One of them is called the locus coeruleus. This one is involved with anxiety, fear responses. It is also right next to the substantia nigra. This is the one that's responsible for producing dopamine, which is going to be the ability to relax, to feel good. It's not the happiness hormone, but it's a feel good, and it goes toward reward centers of the brain. And interestingly, at least this is what we know, the concept of vertical scrolling, so whether this is going to be a slot machine or this is going to be the apps on your phone, that there's something about looking up and down in a continual motion like this that is extremely addictive. This is one of the reasons why the apps are on your phone the way that they are. How many times have you been looking at social media and you're thinking to yourself, I've been scrolling on this thing for like the last 5 minutes and I'm not seeing anything useful, but I'm still going. Why is that? It's the addictive nature of it. Same breath, this circuitry in the brain can actually be used sometimes if a person is having a sense of anxiety, that locus coeruleus, that by doing deliberate vertical scrolling like this, with breathing, it actually help bring your physiology more to equilibrium. So that's that first little guy in the yellow. Now the second guy, this is the one that I'm seeing more stuff going on clinically. This is a little guy with another mouthful of a name, nucleus prepositus hypoglossal. It's located down in the medulla, so the inferior part of the brainstem. This guy is responsible for stability looking left or right. And what will often happen is if this guy is getting overloaded, is that if you are deliberately trying to hold your eyes off to one side, you're going to notice that you are starting to get blurry vision. And what a therapist will notice if they're ever testing this, because this is what I've just recently been seeing, is that the eye makes a little flicker, what sometimes is called a gaze-evoked nystagmus. That instead of holding it stationary, it starts to flicker or rotate just a little bit like that. And that is illustrating that there is a weakness, that the bandwidth that's required to do that very simple action is fatigued. And a person then is going to start to feel a little bit woozy in the head, maybe a little bit dizzy, lightheaded, but they're also going to notice that their vision goes blurry. This can be a factor certainly of the eyes, but what I'm also illustrating right here is that this could be neural fatigue. We then have to identify what the source of fatigue is in order to actually make an appropriate correction for it. So that's just a little bit of the neurology here. And I'm going to kind of jump ahead a little bit then, talking about what's called an optokinetic reflex. This has to do with gaze stability, and it's usually in the horizontal plane. In brief, have you ever looked at a fast-moving object? I want to think that you're at a crossroad and there is a very fast-moving train going right in front of you like this. And let's say that you are looking straight ahead. Well, there's actually a reflex where very subtly your eye will track the object and then come back to center like this. And that is a normal reflex if and when you're ever looking for that. But the interesting thing is that can also be used to retrain the brain. If we're having an issue where we're moving our eyes to this side and we're trying to hold them right there, but they're really struggling, what we can do then is use this exact same optokinetic reflex, but going in the opposite direction to strengthen and retrain those brain centers. So think of this to a certain degree, not just as if exercising a muscle and not even exercising a muscle in the eye, but strengthening a neurological reflex. That if you can get that reflex to become stronger, as a result, this sensation of dizziness, blurry vision does not have to be near as pronounced. So let's have a little look in terms of how you can do that. All right, this is an example of what's called an optokinetic strip, and I've just put a couple of the horizontal versions on my particular webpage, so you can go check out those videos. In this example that we have right here, you can see that these stripes are moving slowly from left to right. So if you were looking straight ahead, what would happen is that your eyes would subtly be going to the right, and then they would flick back like this, if you were assessing that directly. Now, what it means also is that these same kinds of stripes can be used to strengthen the exact opposite. So let's say that you are looking toward the left. So you're looking toward the left here, but as a result, whenever you are doing that, you start to feel a little bit dizzy. Well, what you can do then is if you have trouble looking toward the left, you can look at this kind of a thing, and not a bad idea to turn your head like this so that this way your eyes are actually going to be having to look toward that side, and you focus on the middle part of the screen. Your eyes will still engage in this optokinetic reflex, but what it's going to be doing is it's actually going to be working to help make things stronger, so that after doing the exercise, you start out for about 60 seconds and you can slowly build toward 5 minutes. You can also increase the speed of one of these things, that as you're doing that, you're increasing the strength of that reflex, and as a result, it frees up more bandwidth so that your body can better process visual and also balance information. This is a very common thing. If people are ever in a big warehouse or they say, I'm around a lot of visual stimulation and I start feeling my eyes going blurry or I start feeling dizzy, this is a very simple exercise that you can be doing at home on your own to strengthen things. Now, there is a caution to that. It's not uncommon when you first start doing this that you're going to feel a little bit dizzy, and there can be other things going on that is producing the blurry vision and the dizziness. I would not recommend that you would just start randomly doing these kinds of exercises without knowing what the correct direction is and how you need to do it, because otherwise you can be making yourself feel terribly much worse. This should be something where you might feel a little bit off, but you would also be feeling clearer in your head, clearer in your eyes afterward. That's how this little guy is supposed to work. So as I'm going to wrap up here, I'm just going to tell you a little bit of stuff that I've started seeing in clinical practice. I have a couple of colleagues who I've had the good fortune to meet and get to know a little bit more over the span of the last year. And when I first met them, they were talking about all of these different eye phenomena: smooth pursuit tests, saccadic tests, optokinetic reflexes, all this. And I realized, I know so terribly little about this. And both of them were going on about how this is such a big idea. As upper cervical chiropractors, we need to be assessing, we need to be measuring this. Now, it's taken me many, many months reading a textbook at the moment to finally begin to understand what they are talking about. Point is I started implementing some of these tests into my routine clinical assessment. We're always learning new things. And sure enough, I'm seeing very frequently that people do have this weakness when you just have them hold their eyes off to one side in particular. That can be a sign that something is going weird in that brainstem area. What I'm doing now, and what I've seen on a few people here, is that when I adjust their upper neck and then I retest that afterwards, we do that, and that's without the stripes. Without the stripes, we do that, and they say, that's not going near as blurry. Things are clearer. My head feels easier. Pretty cool. So this is illustrating here that not only does the inner ear have an impact on this kind of reflex, but by correcting issues that are in the upper part of the neck, that is going towards promoting better stability of the eyes and also freeing up more bandwidth so that the inner ear is able to do what it is supposed to do. I did a video on this just a couple weeks ago, some new research that's come out saying that, hey, when you're correcting issues in the upper part of the neck, it's having either a direct or an indirect effect on eye function. So not only is there evidence to support this, but I'm also seeing this clinically. I'm really excited to be implementing more of this, and then also now knowing, that there is a specific exercise that I can recommend to people that's going to, again, help improve that bandwidth. So watch this space, and we'll keep you up to date in terms of more of the stuff that we're seeing. But I'm really excited to see these types of connections, knowing that what we are doing in the upper neck is having an effect that goes well beyond headaches, neck pain, but it's actually affecting and enhancing neurological function and gain. So thank you guys, as always, for watching the video. If you've liked it, please do click that like and subscribe button. If you've got that friend, family member, client, colleague who you think could benefit from watching this video, they've maybe been to the optometrist, they've had a few different balance tests done, but not quite sure what's going on. There could be an issue that's being missed in the neck. Share this information with them. And then if you want any more information, you can go to our clinic website, which is ChiroPractic.com, where we've got a whole bunch of other videos, blog articles that talk about the relationship of the upper neck and how it affects brain to body function. Thank you guys again for watching. This is Dr. Jeffrey Hanna at Clear Chiropractic. Get well, live well, and stay well.